Good evening, everyone, and thank you so much for taking out time today on a Friday evening. I understand most of you are practicing and have had a long day in the OPDs to come today, but we try our best to make this session as insightful as we can. And joining me is Dr. Kirti Samudra. She's a very renowned name in the field of diabetes, carries decades of experience, and is also a great adopter of technology and using whatever is the best means available to achieve patient outcomes. So, welcome, Dr. Kirti Samudra, for today's
Thank you, Dr.
biotech.
Manthan.
So, Dr. Kirti, when we talk of technology today, right, and it's the buzzword, everybody is talking about technology, AI. Every conference you go to, people have questions around what are you doing about AI? Is it going to replace doctors? Is technology hampering anything? Are patients becoming too aware? And there are, of course, plus sides and positive discussions also happening around the field. So, it's becoming more like a boon or bane kind of situation with technology and diabetes, being one of those larger prevalent diseases today in the country. Uh, that's where people want to make a difference, right? Even when we talk of companies that evolve with technology, they want to be in that space where there is maximum population and they can impact more lives. So how you've seen many years of practice, how do you see now technology is evolving? How is the diabetes care landscape changing?
Yeah. Um, I should say that I come from the generation where I don't know whether I'm too much for technology or maybe AI or what is going to happen. That also means everything, whatever is happening now, whether I will be able to adapt. That is also a big question for me. But definitely, this part of technology, which is involved in knowing the sugar and the fluctuations in the sugar and the glucose variability, it was never thought of that. Means when I started practice, or maybe for initial many years of practice, I now feel that I was, or maybe most of we doctors, we used to treat the patients somewhat with intuition, or maybe just blindly, that the patient is coming to us with one sugar report of fasting and postprandial, that too after many months. At that time, even SMBG was also not so predominantly used. Patients never had glucometers also at home. And just after many months, when they are coming to for follow-up, they will do one fasting PP sugar and they will come with that report. And on that report, we have to modify their treatment, or we have to advise them what exactly is to be done. That was so funny and bad actually on the patient. That's why maybe people were suffering too much with complications, and we never used to uh, get them to prevent complications. We never used to get the opportunity to see to it that their sugars are very well under control. Their HbA1cs are, even HbA1c was not so popular in my initial years of practice, and even telling the patient to get HbA1c done was also a very big thing. Even lipid profile and all these things, these investigations were so problematic. So now, with the availability of this technology and making them understand, it's really means for us, it is really a boon in this field. Definitely, I will say that now we can somewhat kind of mathematically calculate what exactly we have to do. And it's not only the aspect of in the treatment part or insulin or in any oral drug, but it is the diet, it is the exercise, it is the lifestyle basically. It can be planned, it can be according to this CGM report, or this we can, even patient himself or herself can see with the means that black and white, I should say red and yellow, with that, what is exactly happening, and they realize that what mistakes they are doing, and what can be done. So definitely this part is helping in the
Right.
treatment.
You touched upon, two very important aspects. One, of course, the whole title, which we talk about, data-driven approach, and how we were in a state where there was a lot of paucity of data. And today we have reached this stage where we have so much of data, like there's so many data points, right? One average CGM device can give you up to 1400, 1500 blood readings without pricking. And you can in real time find out how things have affected you. So that whole cross-sectional approach, where there is one report that the patient comes with, and like you said, a lot of it was based on medicine as an art and clinical judgment, where we were doing things, and a lot of things were more trial and error basis, so to say, and where we did the best for our patients, but that was all we could, right? Even we were helpless in terms of the amount of data presented and, of course, the cost to acquire that data also, right? We cannot put all patients on systems like that and add additional burden. But today that access has changed, a lot of things have changed. And two, I think you spoke about, metrics being changed, right? We used to talk about only fasting blood sugar at one point, then PP, and then we started the glycemic pentad now with HbA1c and other parameters. And now, in our quest, I think for as humans, we always want to evolve. And, we now are looking at what beyond A1c, and then now time in range is something which is coming up as a metric, and a lot of technological advances are helping us. But you mentioned it's a boon and it helps us in many ways. But at the same time, we're also seeing, rampant use of this technology even in non-diabetics. So people have, now started using it for biohacking, health has things, and we see them all on social media, very fit looking people, non-diseased, using all these devices. Some are even trying to use these devices in obesity. So what is your take? I mean, how rational should we be with using CGM devices, and how experimentative can we get by using such technology?
If you ask me, I will totally say it's not required for other things, like means the way it is being used by a non medical or non-doctor community, I can say. It's like it's somewhat commercially used, maybe, and it is just to attract the clients sometimes, maybe, that they are showing something scientific they want to do, and it's I don't know how much they also understand in that, or whether what output they will get from, means what input they are deriving and what they are offering to their clients from this. That is also a big question. And it's not necessary as such. It's why they are using being it is being used. I really don't understand, and I don't advocate using by gym people, or maybe even the nutritionist. Sometimes the nutritionist, if she's along with a doctor attached, or maybe, then okay, they can do it for. But otherwise, I feel that it's this is a device should be used properly, and whenever really it is necessary. Why unnecessary use it
Yeah,
just
correct.
like that?
Yeah, I think fairly put, people, it's like giving people a new toy and you just want to
Yeah.
try it out. Uh, at the also, we spoke about how many data points that devices can generate and give it. In your practice, have you felt that it's overwhelming sometimes for patients, or even for doctors, or they're trying to communicate with you? Because uh, at a point, in the older days, like you said, it's easier when you have one single report with two or three values and the normal range is written by the side of it. So very easily the patient understands कि मेरा शुगर बढ़ा है, कम हुआ है, क्या हुआ है, and medicine, आज डॉक्टर के पास जाएंगे and medication will increase or dose will decrease. That conversation was going to be very straightforward. I think both parties could predict what is going to happen in the OPD today. But now with all these data points, and they'll come with these reports, in all these colors and graphs and TIR, um, how challenging does it become to talk to the patient, explain them what this report means and how to change, and and we're all crunched for time in OPD, right? So we
Yeah,
also want to get away with it quick. So any tips on how to navigate this, and any anecdotes that you have from your practice?
Usually, like in my case, it's like only whenever I advise them, then only the patients will do it. It's not that patient is already put the device and then come to me to understand. It's usually for so I take some time to explain them why I want them to be on this device and what is the need for this. Because many of the times, what happens is they come with the report, the HbA1c and fasting PP, and it's not at all correlating. Sometimes the sugars are high, HbA1c is low or quite normal, and sometimes HbA1c is very high, but sugar reports are very normal. So something somewhere is mistake. I can just tell them that, see, this is not explained. Are you doing sugars at home, and how many times you do? If patient is not doing very frequently, and they don't know that sometimes it is hypo, sometimes it is hyper variability, if they have not noticed, then definitely I have to tell them that I strongly suspect that there is a variability, and we have to find out what exactly it is. So this is the device, and which will give us complete picture. So you will also come to know that what is happening. And then with I usually call them within 1 week only. First means once I attach the sensor, and after 1 week only they realize that, oh, what is happening. Maybe sometimes it is midnight hypoglycemia. Whole night the patient was in hypo and during sleep, and he has not realized it. And all these um, colors and all the, when they are, we explain them, then it is really that they understand, and they means they feel that, yes, good thing that I accepted this, and this is a very nice thing which I did. So this is how we have to do. We have to spend some time. That is true, but it is good for the patient.
Right. I
That's
think,
what we want to do it. Yeah.
absolutely. I think patient first. It's the center. The patient is at the center of all of this, right? We all in healthcare are trying to adopt technology, evolve, even develop technology so that life becomes easy. I remember we once presented a protocol for something in diabetes, and we asked the ethics committee that we want to do 9 points of SMBG in a day. And they said you should just double the compensation offered to the patient because you expect them to prick 9 times daily. So, from there, we've come to just a prickless device. So, I can imagine, how things have changed and how now we are adopting to it and doing it in a great way. So, one extension to this, are again digital therapeutic programs that come out, which utilize all this data. Again, saves time for doctors because there is somebody else analyzing it. There is probably some technology added to give insights which are more real time, and again, expert coaching and other things can happen. So where do you see digital therapeutics fitting into diabetes practice today? Because we see there is a lot of resistance in some way, where people feel that we don't know whether this will do, or whether this is actually needed for a patient or not. And selecting the right patient is also very important, like we said about the device also, we can't put it on everyone. So similarly, not all diabetics need a digital therapeutics program. So what is your thought on the right patient selection, who benefits the most, and what have you seen over the years?
Actually, it will benefit to more number of patients if really they are willing to take it, and if they, but most of patients are not so much willing to take up such type of digital therapeutic advice. But younger patients who are very, very well aware of the technology and all the maybe pre-diabetes people who want to prevent diabetes, or who want to reverse diabetes, early stages of diabetes, who are very much motivated to uh, for reversal of diabetes. I see good acceptance from these people. I would actually, even people who are already developing complications or going in for renal complication or cardiovascular complication will also do that. But somehow, at least in my practice, I couldn't convince many of these patients to go for such kind of digital therapeutic means on that way. But maybe in future, when the acceptance is more, some people will do accept it, because some people keep on asking any other ways of treatment, like, so they want the holistic way, and this is not much required even in our clinics also. If I have a nutritionist, or if I have a maybe some exercise advisor, they will do it only once. Patients are not going to follow uh, again and again with that nutritionist, or maybe a diabetes educator also. So something like a digital platform, and continuously getting the messages or getting the
Right.
advices, so that should help. It will keep motivating also. It will there are many advantages of it. Sometimes it becomes little more maybe sometimes some people don't like it to
Yeah.
be continuously. So
True.
again, depends on the person to person.
Right. No, I think very well put. It's a lot to do with the patient's motivation factor. And like you said, people who are keen on remission, reversal, don't want to start medications or want to probably stop them or have reached a stage where they think they can do well. And those are people who do it and get those results. And there are others who uh, get irritated when, they are nudged constantly to do something and think of it as an intrusion in their life, that this is like, in a way, the doctors, somebody from the doctor's clinic is actually monitoring me all the time. So some people like it, they want to
Yeah.
like have a doctor beyond the clinic, right in their fingertips on the phone, and will appreciate it. A lot will feel the other way around, ki, I don't want to be bothered so much. I visited the doctor, I am following advice or not, I will tell the doctor when I visit next time. So
Yes.
yeah. uh, with these, the way these things come, and a lot of people think of these as this or that. You do digital therapeutics or do traditional medicine, but I think we believe there is a lot of complementary nature to it, right? We cannot say, unless patients are super motivated and they're trying for aiming for remission, there's a large majority of patients who will only be aiming at probably dose reduction, good control of sugars, avoiding complications, etc., and the holistic thing that you spoke about. So, uh, for doctors as well, striking that balance becomes difficult, because I sometimes hear a lot of them saying that if they go for digital therapeutics, then they may not, they will instantly want to stop medicines, and then they come back, they are not able to follow or sustain, and then they come back with complications. So we are really worried, and I think everybody in this ecosystem, the healthcare ecosystem, is worried about the patient, right? Be it digital therapeutics, which is trying their best to change habits, change behavior of patients to attain a good lifestyle, where doctors are trying their best to support them in all ways possible, and there are pharmaceutical companies bringing in a lot of medications which support them. So it is actually the holy trinity in a way where we are working at. But uh, there is this expectation mismatch, right, where it comes that patients also feel that, okay, if a doctor puts me on this program, means I will be off medicine soon, so they start thinking that way. And doctors sometimes think if they go on the program, the patient will not come back to me soon. So uh, how do we juggle this, and in a on a lighter note, how do we probably convince both the parties, doctors as well as patients, that it's not this or that, they
Yeah.
can coexist.
Yeah. See, failure of treatment, or even failure of digital therapy will happen again and again. Means patient, if he goes into remission, or maybe sometimes reversal, again after a year or so, or maybe patient is going to, because what happens is they go into overconfidence that, oh, now everything is fine, and then the sustenance of that program, or continuously means continuing that kind of lifestyle, is a really really big problem with the patients, and then they again sometimes come back with all the previous type of reports. But if you ask me, or maybe some doctors, like we are into practice for so many years. So now we people are not worried about losing patients. So like we will, even if patient goes on digital therapy and goes into remission and doesn't come back to us, okay, we are happy to, no problem for us.
Right.
So that way it won't be a problem for most of the doctors that we will lose the patient, because patients number is so much that we just can't even attend all the patients. So
Right.
that is not a big problem. But really, if we patient sees some testimonials and people really means feel that yes, this may help me in reducing the medication, or maybe going into remission, sometimes in the reversal, or in long run this is going to help me in preventing or prolonging the complications, then definitely slowly this will come up. And now only some changes are happening, and maybe in near future, or this acceptance to this therapy or digital support will be more, because even the doctors are talking about it more, and patients are also reading about it, learning about it from social media and everywhere. So it's like they also ask. And here in India, we have younger population going in, developing diabetes and all other lifestyle diseases, hypertension, obesity, everything. So it's definitely younger acceptance to digital therapy or is better with younger people. And I'm seeing a good help maybe we'll be getting from this kind of therapy.
Right. I think very well put. And, we are a young country as a population. If we go to see, we are a young country. And unfortunately, a lot of new data coming in because of sedentary lifestyle, stress. People in 30s, I think, very high risk population for pre-diabetes, hypertension, all of those, I think, metabolic disorders as well. So, adoption, and I think even the seniors, right? Adoption of digital is so penetrated, and thanks to I think COVID and many other factors, that everybody is now used to using phones, right, from banking to ordering things to booking a cab. So they understand this, but at the same time, while these apps help us in a lot of way, we miss that human centered approach, right? So that is also something which people ask about, right? When you would probably be prescribing digital therapies, people would always be worried that, is it going to be an app? And today, with GPT and AI and bots and everything, even if it's a genuine person talking, they will doubt whether it is a real person or it is a device talking to them. And somehow in India, we are very used to having people around, and not so used to having machines around us. So uh, how do we probably talk to the patient about it? How do we, and what would you suggest also to app developers and others, doctors also using technology? How do we maintain that human centricity in that conversation all the time, right?
I don't know how much it is possible. It will be again digital only, even if you do video consultation or video chat with the patient, but still that touch will not be there. It will be just a visual this thing. But people, as you rightly said, that they do need some human contact. And sometimes I have experiences like, means even if patient is coming to the clinic and doing everything, and if he doesn't uh, see me, or maybe don't meet the doctor, like, means it's not me, it's everybody who so they feel very restless, and they sometimes they still I want to just see and meet for 1 minute. So even that satisfies them sometimes. If you come in and so a good, so that is very much required, especially in our country. And yeah, so it's very right, very true, but maybe the visits can be minimized, like patient, otherwise patient therapeutics may not be coming to the doctor. So they can come and visit the doctor, and other things can be handled maybe just like
Right.
that online
Right.
or
I
app.
think that's why involving, a doctor, and if doctors prescribe this rather than patients going, directly to any of these platforms, and them getting, probably lost in transition. It's the best because I think the way the doctor-patient relationship is there, and that element of trust is there, and like you rightly said, if they don't just see you, or even if there's nothing, it's just a follow-up, everything is done, but if they see a doctor, the consulting doctor is around, they get that faith, and I think they are not worried, right? Their distress is always lesser. So I think, even here, if more and more doctors adopt to it and they play an active role, because uh, I think just their presence, like you said, is more than enough for, patients to trust the digital platform completely, right? I think they just want that push from the doctor that okay, I'm telling you, this is, a good platform, or this will help you, and then they are willing to try. So I think keeping that at the center is very, very important, rather than letting patients go here and there with digital, and then just for, being lost, and
Yeah.
not being lost to follow up, but somehow being lost and overwhelmed with all that information, and which program, what program, compared to what a doctor can say, even if it's just 2 minutes. I think that can really help. So on that note, another thing is, how do we as, doctors, again, prepare for, and if, with all these technologies that are going to keep evolving, right? And it's difficult, one, to keep pace, to know, of course, what all is coming. Two is also to trust which ones to trust, and what can we adapt, and what makes our life easy, and what makes the patient's lives easy. How do we strike that balance? So it's more of a mindset, I think, that doctors need to develop. But if, with so much of experience, you've seen like days where I think books only mentioned metformin and sulfonylureas, and today we talk of, cardiorenal benefits and anti-obesity drugs and so many things, right? You've seen it all, and then now we are seeing this whole new phase of technology coming in, which is just picking up, and probably the next decade will be where it will be more adapted and involved in life. But how do we manage, and how do probably you personally manage to keep pace with so much rapidly changing technology?
When I started practice and when I started my first diabetes clinic, as you rightly said, there was nothing, means only fasting PP, sometimes HbA1c, and metformin and sulfonylurea. So what great things I was doing that time? Nothing. Means like there was no fun as such actually. Just educating patient that no, this is a lifelong disease, you have to do diet, you have to do exercise, you have to take medicines, and you have to keep checking, that's all. And if at all somebody develops complication, then we maybe treat those complications. That's all what we were doing. Nothing. Even if I feel that this patient is requiring something else, but there was nothing available. Now once the glucometers came in, and then the uh, drugs started coming in, different drugs. There was first time actually it was glitazone, rosiglitazone and pioglitazone. So fascinating that, oh, something for insulin resistance for Indian people, something is coming. Different types of insulins. Then they started coming, and then somehow now those we have so many drugs and available, and we now decide. So individualization of this therapy was anyway there, but we didn't have anything to offer. Means even if we know that this patient is different, this patient is different, but at the end, what we are going to offer? It's the same sulfonylurea and metformin, nothing else. But now we know that whom to give insulin, whom to give sulfonylurea, whom not to give sulfonylurea, whom not to give SGLT2. So everything is now there. So the specialized diabetes care practice is actually now last few years, maybe last 10 years, I'm enjoying a lot, because I can think I can give a personalized treatment to every patient of mine. I don't have to treat every diabetes as the same type of treatment. I can offer different things, and I can help the patient to prevent the complications in long run. So that's the aim actually, that my patient should not develop all the complications of diabetes, which otherwise he would have developed if it was not treated properly or it was not managed properly. So for this, there's so many things happening, so we have to adopt. Otherwise, nothing means the word means we will be actually depriving patients of good things. So that we have to learn anyway, whatever is coming up. And once we also learn, or we also see the, we start using the thing like whatever comes new, then our own experience and then all the evidences what we read through. So that is good. But as I said in the beginning only, I said that I don't know how long it will, means how much it is going to evolve, and whether how much I will be able to adopt it. Not everything maybe, but whatever possible, definitely we will do, and maybe we'll take the help of you people that who are there at the back to support this all digital or AI based therapies and all. So maybe we'll have to take some help, like people like you.
Right. Right. I think very well put, right? It's an entire journey, and in general, doctors are not very quick at adopting technology, right? Even for scientific evidence, it takes a while, and what comes probably there is a lot of fascination initially to begin with, but till they don't try it in certain patients, till they don't hear their peers talk about it, that also matters a lot. That okay, I tried this in my practice, and this is what happened, and this is working. Maybe do this. These are some things, which some issues that are coming up which we didn't know with the evidence, and that is still all under control because we understand evidence, we understand that science. But when it comes to technology and artificial intelligence, lot of gray area, I think, for all doctors. And you of course were very generous enough to say that you are willing to adopt and also take help wherever needed, and not antagonize it, because we've seen a lot of people look at technology as a barrier, or some people look at it as competition, that this is not probably going to work. But the way you just put it, that we can all integrate all this and adopt it and put it there. And I think you also touched very well on the personalized aspect, I think, which is the theme today. And it's what we all want. Like you said, you always wanted to personalize care for diabetes, but had to wait for many years for every technology, every evolution to come in terms of new molecules, new science to come in. And now, once that is also happening parallelly, now there is new technology which is helping personalized care, right? Like you said, you use CGM so that they get more personalized responses. You call them after a week so that they know what is working, what is not working. So I think whole evolution is all only to benefit patients, and integrating this, and we have to navigate this landscape. And I think all doctors can learn a lot from you on how you have evolved this and integrated it in your practice. So thank you so much for that. I will now just open it up for the audience. If they have any questions, please feel free to chat. And I think as a feature of the program, you can probably unmute yourself as well, or raise your hand, and I will help you to get. Please feel free, I think, to put your questions in the chat, or you can raise your hand and we can help unmute you. We don't see many questions. I think the explanation was quite simple, and it was a very interesting conversation, Dr. Kirti. Thank you so much for all
Thank
your
you,
time
Manthan.
and
Thank you.
wonderful insights that you've shared today. And we will help, these insights to reach to more and more doctors, through all the media and platforms that we have. And we will definitely help this message go across, which is quite inspirational, that we need to adopt to the changing times. And I think change is the only constant, as we say, and we should put it even, in our diabetes practice. So thank you so much. And thank you to all the people who have attended and taken time for this. Have a good night and a great weekend ahead. Thank you.
Thank you. Thank you.
Thank you so
Good night.